Can hand sanitizer replace soap and water?
Many people wonder if using sanitizer is just as good as soap and water. Understanding the differences between the two can help you make safer and more effective decisions about hand hygiene.
When is hand sanitizer effective?
Hand sanitizer works well when your hands aren't visibly dirty or greasy. It can quickly kill many germs, including viruses and bacteria, especially if it contains at least 60% alcohol. It's a convenient option when soap and water aren't available, such as after touching public surfaces or before eating on the go.
When should you use soap and water?
Soap and water are best when your hands are visibly dirty or after certain activities. Washing with soap removes dirt, debris, and more types of germs. It's especially important after handling food, using the restroom, gardening, or caring for someone who is sick. Experts agree that this method provides the most thorough cleaning.
What do health experts recommend?
Health organizations like the CDC and WHO recommend soap and water as the first choice whenever possible. Hand sanitizer is a useful backup but not a complete replacement. Sanitizer may not remove harmful chemicals or all types of germs. For best protection, use soap and water when you can, and sanitizer only when washing isn't an option.
Key takeaways for everyday life.
Carry hand sanitizer for convenience, but prioritize hand washing when possible. Use sanitizer on clean-looking hands in public or when soap isn't accessible. Always wash thoroughly after activities that expose you to dirt or germs. Following these simple guidelines keeps you safer and healthier in daily life.